afternoon, everyone. Thank you for being here. What a great and historic moment in the history of the city of Philadelphia, a city that prides itself in looking out for its citizens. When you think about the great history of the city, first hospital in the United States of America, all the firsts in healthcare, and of course one of the leading economic sectors for the city, but also a place of great research, a city that looks after the health of its citizens and also certainly provides jobs and economic vitality, research dollars coming to the city, and the hundreds of thousands of students who are educated in our many institutions of higher learning. I'm pleased to be here, and I want to commend the leadership of Councilman at Large Bill Greenlee on this particular issue, and he has been a champion for the health and safety and welfare of people in the city for a long period of time. But this issue is particularly pertinent, certainly timely, and very meaningful to me and so many other folks. Of course, our Deputy Mayor for Health and Opportunity, Dr. Don Schwartz, is here, who's also the Health Commissioner for the City of Philadelphia. And in that context, let me also recognize a former Health Commissioner for the City of Philadelphia, Dr. Walter Sue. Dr. Sue, good seeing you, and my champion and partner in an effort many years ago. And again, thank you so much for your leadership here in the city. We're also joined by Dr. Nadia Peter, representing the American Academy of Pediatrics, the Pennsylvania chapter. The Get Healthy Philly team, I want to thank them for all of their hard work, and I saw him as I was coming in, but I now see him. Dr. Malia, thank you so much for your great leadership on the health department side. Dalton Paxman, the Regional Health Administrator, I want to thank the Department of Health and Human Services at the federal level for all of their help and support in this effort. And I didn't see him when I came in, but I worked with him a great deal. His name is in my notes, but I don't see him, but I'm going to give him a shout out anyway. And that is Dr. Frank Leone, Director, Comprehensive Smoking Treatment Center at Penn, and again, along with Dr. Walter Sue. In a previous capacity, I worked very closely with Dr. Frank Leone on our clean indoor air smoking regulations. I'll be very proud today in a few minutes to sign two bills that promote and protect the health and wellness of every Philadelphia citizen. E-cigarettes, as we know, are an unregulated item at the federal level. Science does not support e-cigarette manufacturer claims that this is a safe alternative to smoking. And over the last few years, e-cigarette usage among our young people has actually doubled. Today, I will in fact sign into law legislation that prohibits the sale of e-cigarette products to minors immediately, and they are unfortunately a frequent target of e-cigarette advertising. This legislation, as I mentioned, will go into effect immediately, that particular bill, and retailers who violate the law will face a fine of at least, at the moment, $250 per violation. We don't know yet what effects e-cigarette vapor may have on the users or people around them just yet. But we do know that e-cigarette vapor has been found to contain nicotine, heavy metals, and even cancer-causing compounds. We do know that. We believe that erring on the side of caution is necessary and important for the health, safety, and welfare of all of our citizens. Beginning July 1st, 2014, e-cigarette product use in public spaces will be prohibited. Dr. Schwartz will tell us more about the rollout process as it relates to the legislation in a few minutes. I also want to acknowledge that there have been strong sentiments about this legislation, as this is Philadelphia, of course, so from both sides. And I want to remind everyone that the Clean Indoor Air Worker Protection Act was also controversial and somewhat divisive at its time. It took 6 years to pass that particular legislation, and I would suggest, and I actually know for a fact, and every doctor in this city, and retailers will tell you the same, and insurance companies will tell you the same, that there are many people who are living healthier lives today, whether they're employees, employers, or just patrons, because of the action that we took many, many years ago. We have saved people's lives, notwithstanding all the controversy, and I would suggest that our hospitality and bar and restaurant industry is thriving in the years since, with people going to many, many places that they would have never gone to in the past, certainly including myself, as a result of everyone being able to breathe clean indoor air and no one risking their life to have a job. We know in the aftermath of all that, we've seen very, very positive responses and results. When you couple the Clean Indoor Act with our Get Healthy Philly initiatives and national anti-smoking campaigns, Philadelphia, in fact, has 42,000 fewer smokers and 42,000 healthier Philadelphians. In fact, since 2008, our city has seen a 15% reduction in smoking rates among adults. Today's bills are sensible extensions of the Clean Indoor Air Worker Protection Act. I want to thank all the people who have been involved in and supported this legislation. Let's keep working together to make Philadelphia a healthier city. And with that in mind, let me bring to the podium and the microphone the great champion in this particular regard, City Councilman at Large, Bill Greenlee.
Thank you. Thank you, Mr. Mayor. Thank you, Mr. Mayor, and thank you for your strong advocacy for the health of citizens of Philadelphia and for your strong support of these two bills. I'd be remiss if I didn't mention former Councilman Green, who first put in legislation dealing with this issue, and two of his staff members who have been very helpful to me as we worked along this are here, Allison Perlman and Haji Malumian. How bad I messed that up. And I certainly would most of all want to thank my legislative director, Noel Marconi. I like the kid but it's actually the truth that when she always comes up with the good ideas, and when I'm smart enough, when I wake up smart that day, I listen to her. And she did all the hard work, the research, brought it to my attention, and put enough facts out there that it was indisputable that we needed both of these pieces of legislation. And certainly I want to thank all members of Philadelphia City Council. This bill passed despite the tremendous efforts of the opponents. We heard radio ads, we got lots of letters, we got all kind of communication, and that bill passed 15-0. And I'm very proud of that because council stood up for the health of the citizens of Philadelphia, for the children and the adults, and I think that's extremely significant, and they deserve a tremendous amount of credit. Because if you were just counting heads and didn't look at the facts, you might think something different. But as the mayor said, the smoking bill got a tremendous amount of opposition at first, and now I think everybody understands that it's for the best for the health of the citizens. And I think looking out for our citizens, particularly the most vulnerable in being minors, I think is something that we always have to keep foremost in our minds. And another person, and I'm going to introduce him now, that certainly was instrumental in this, because just by adding his name to the support of this bill contributed to its success, because he has done such great work over the years before he came to the administration and certainly since he's been here. And so I just want to publicly thank he and his staff for all the work they did. So I'm very happy now to introduce the real champion for this issue, Dr. Donald Schwartz, Deputy Mayor for Philadelphia.
Good afternoon, everybody. I am delighted to be here, and I want to begin both by acknowledging that I have the best boss in the country, and I want to particularly acknowledge the leadership and, I will say at times, bravery of Councilman Greenlee and his unflagging support of public health in Philadelphia. I also want to thank the many partners who were able to help us in being successful in this initiative. The Philadelphia County Medical Society, the American Academy of Pediatrics, from whom you'll hear more, the Greater Philadelphia Business Coalition on Health, Independence Blue Cross, the Fox Chase Cancer Center, Penn Center for Public Health Initiatives, Jefferson School of Population Health, Drexel School of Public Health, and the Temple Public Health Program. What you hear from that is that we have unanimous and universal agreement and support from the health and public health leaders in Philadelphia on this issue. Over the last 4 years, the Get Healthy Philly initiative, under the leadership of Dr. Giri Dharmalya, who has been mentioned by the mayor, has been able to press forward in our work to reduce the addiction in Philadelphia to tobacco. We have seen a 15% reduction in adult smoking, a 10% reduction in youth smoking. Illegal tobacco sales to minors have declined by over 30%, and calls to the Pennsylvania Free Quit line have increased 5-fold. In just the first 2 months of 2014, over 1,000 Philadelphians have called 1-800-QUIT-NOW, the Pennsylvania Quit line, to receive free counseling and up to 8 weeks of free nicotine patches or gum. What is remarkable is that when we started, and when the mayor first made this an issue in Philadelphia, you couldn't get free nicotine, and the number of Philadelphians who would have called this month to the quit line was probably countable on one hand. As the mayor outlined, the 2 bills before us will prevent youth from becoming addicted to nicotine and will protect non-users from secondhand vapor and help businesses enforce the Clean Indoor Air Worker Protection Law. Among the local efforts, we believe that, along with local efforts, we believe that a critical piece that is missing, and I think that was key in all of our decision-making to move forward with this initiative, is that e-cigarettes as a product are not regulated at the federal level. We believe that the FDA is the appropriate agency to regulate federally, but they are not regulating the manufacture of e-cigarettes. They are not regulating the packaging or labeling of e-cigarettes, and it isn't for want of trying. Currently, that means that the contents of e-cigarettes is unknown to many of us, even those who use. Moreover, what we know is that e-cigarette use is causing a rapid increase in calls to the National Poison Control Centers, so that nicotine in liquid form, which is in the little liquid-containing capsules in e-cigarettes, can be toxic and, for children, potentially lethal. So the U.S. Poison Control Centers have reported that the calls to poison control centers per month rose from 1 call per month in September 2010 to 215 calls per month in February of this year. We are very worried about that as a toxin, and that is not something that will be prevented entirely by these laws, but hopefully with the attention that these laws will bring, parents who use e-cigarettes and others will be sure to protect children from those little glass capsules with their high concentrations of nicotine. Philadelphia, e-cigarette youth sales will go into effect, the ban on e-cigarette use will go into effect immediately. The health department will begin doing what we have done before with youth sales of tobacco, which is education. We believe that most people who sell these products will do the responsible thing, but they may not be knowledgeable about the sales ban. So while the ban goes into effect today, our first step will be to educate the retailers. To enforce the law, the department will use the same process that we currently use for cigarettes, which is we will have undercover minors who are supervised by adults go into retailers and they will attempt to buy e-cigarettes. If they are not checked for ID and if they are sold e-cigarettes after the period of education, we will issue tickets of $250 for businesses who are found to have sold e-cigarettes to a minor. We document the process carefully, but we will be serious about this. The indoor air law, which was also passed by council, will go into effect according to the law on July 1, 2014. This law, as you have heard, prohibits the use of e-cigarettes in workplaces, restaurants, bars, clubs, and other indoor spaces, including retail and wholesale stores, movie theaters, museums, performance spaces, child and daycare centers, schools, hospitals, and common areas of apartment buildings and hotels. We believe that this will also mean that hotels will have to designate rooms as rooms for no use of e-cigarettes. The law applies to all smoking devices, such as e-cigarettes, e-cigars, e-hookahs, and vape pens, and ultimately businesses who are affected by the law are themselves responsible for notifying their staff, clients, and visitors about the new policy, including posting signs. And we in the health department will look for those signs. They can modify existing signs or put up new ones that state that e-cigarettes are prohibited in those venues. To enforce this law, the Department of Public Health will use the same process we've used for cigarettes, which means that if the public complains, we will go out on the complaint. We will begin again by education. Remember again that we believe that most retailers are responsible, and if educated, they will do the right thing. And if we find after education that businesses are not doing what they're supposed to do, both in terms of signage and their own use, we will set up a system both to enforce, as we do with regular cigarettes, and we will continue to educate. So for the first 6 months from July through December of 2014, we will call it an education and warning period. Thereafter, if violations are noted, beginning in January of 2015, we will issue tickets for $300 per violation. Certain businesses, I should point out, are exempted from this law, including e-cigarette specialty establishments, otherwise known as vape shops, with at least 50% of revenue coming from the sales of e-cigarettes and tobacco products, such as cigar shops, or those with at least 90% of revenue coming from tobacco sales. Applications to be designated as an e-cigarette supply establishment will be available online through the health department soon, certainly before July 1. Drinking establishments and private clubs with existing waivers from the Clean Indoor Air Worker Protection Law will also be exempted from the e-cigarette rule, and additional businesses will not be able to apply for this exemption. So if there is no current exemption, there will be no further one. I want to end by echoing the Mayor and Councilman Greenlee. We encourage people to stop smoking cigarettes. And we know that most smokers wish to quit. The department has dedicated itself and will continue to help people stop smoking. We know that smoking on average reduces life expectancy by 10 years. We know that it causes strokes and heart attacks, infertility, 10 different cancers, and the number of cancers identified as associated with smoking increases every year. It is responsible for asthma. It is responsible for chronic obstructive pulmonary disease, or COPD, and sudden infant death in some cases. It is never too late to quit. So, what I say to all the smokers out there who are listening to this, please try to quit. Please try to quit with help. For some people, e-cigarettes and the nicotine in e-cigarettes could be an effective way to quit. But what we say to everyone is, quit with help. Call the helpline for the state, 1-800-QUIT-NOW. Go to your healthcare professional and ask for help. Do it in a planful way. Smokers are twice as likely to quit for good if they quit with help. We have, from the health department, a website, www.smokefreephilly.org, www.smokefreephilly.org, that anyone can go to for both tips on how to quit smoking and links to appropriate smoking cessation resources. It may take multiple attempts for people, but people can successfully quit smoking. Finally, I want to say that all those who are here who supported this legislation need to feel good about what we've accomplished. We look forward to working with all of you to continue to promote public health in Philadelphia. One of our great partners in this and other efforts has been the American Academy of Pediatrics, folks who really care and look out for children. I am very pleased to introduce Dr. Nadia Peter from St. Christopher's Hospital for Children, who is here representing the Academy today.
Thank you very much, Dr. Schwartz. Mayor Nutter, Deputy Mayor Schwartz, members of City Council, and distinguished guests. I am honored to be here today to represent the interests of children and teenagers who it is our responsibility to protect their health. I'm also here representing the 2,200 members of the Pennsylvania Academy, American Academy of Pediatrics, who applaud the Mayor's Office and City Council for enacting this legislation to help protect our kids from the potential harms of e-cigarettes and from prevent them from becoming addicted to nicotine, which is present in these e-cigarettes. The two bills that will be signed into law by Mayor Nutter today will help prevent the sale of these e-cigarettes to minors. Over the past decade, we've actually seen a remarkable decline in the use of all tobacco products by youth. However, in the last 1 to 2 years, this decline has leveled off some. Much of this is due to the use of other tobacco products. E-cigarettes are among them. The use of e-cigarettes by kids has doubled over the past 2 years. Many of the kids using e-cigarettes are actually even younger kids, including middle schoolers, and many of the kids who are using e-cigarettes have never tried conventional cigarettes. And that's especially true for the middle school age population. E-cigarettes may be less harmful than traditional conventional cigarettes, but they are not harm-free. For one thing, they contain nicotine, which is a highly addictive substance. They also can cause respiratory problems, nausea, vomiting, sore throats. As Dr. Schwartz said, the e-liquid that refills the e-cigarettes is highly toxic when ingested, and the CDC did release a report this week showing that there's been a substantial increase in calls to poison control centers regarding these substances. For an infant, the concentration of the nicotine in the e-liquid can be lethal. The purpose of e-cigarettes is to help established smokers quit smoking. And as Dr. Schwartz said, there may be some benefit for established smokers in reducing cravings. However, the way the e-cigarettes are being marketed with colors and exciting flavors like Java Jolt, celebrity spokespeople, are not just attracting established smokers for whom flavors are probably less important. They're also attracting new users, especially kids. These regulations will help protect our kids from being drawn to these products and help protect our kids from becoming addicted to nicotine. And hopefully we will continue to see the rates of kids using tobacco products, all tobacco products, continue to decline over the next years. In closing, thank you for the opportunity to be part of this exciting event. As a physician, I'm really happy to have these regulations in place to help protect my patients and their families. On behalf of the Pennsylvania chapter of the American Academy of Pediatrics, I would like to thank City Council and everyone in the Mayor's office for their leadership on this public health issue.
Dr. Peters, thank you very much. So what's going to happen now is the two pieces of legislation are over on the table. I'm going to move over there, sign those pieces of legislation, and then for the media, we'll come back, and I'll be glad to respond to any questions that you might have about today's action. Okay, we have two pieces of legislation. They are bills number 140096. This is amending Chapter 9600 of the Philadelphia Code entitled Service and Other Businesses, clarifying penalties for violation of Section 9622 entitled Cigarettes and Tobacco Products, and by adding a new section to prohibit sales of electronic smoking devices and unapproved nicotine delivery products to minors under certain terms and conditions. This is now law. It takes effect immediately. And the second bill is Bill number 140095. This amends Chapter 10600 of the Philadelphia Code entitled Public Places, Prohibited Conduct by adding a new section to prohibit the use of electronic smoking devices in public places and in the workplace under certain terms and conditions. It is signed. This bill goes into effect on July 1st, 2014.
Congratulations on harming public health and deceiving smokers that many e-cigarettes are hazardous.
You're fine. Okay. Thank you very much. Appreciate your opinion. Are there any questions from the news media? Thank you. He's fine. He's good, Sergeant. He's harmless. His cigarette or that device may be harmful, but he's harmless. So we're fine. He's not going anywhere. Yes.
Mr. Mayor, what would you say to supporters of these products that this is misguided moralism?
Misguided moralism. That's interesting. They probably made the same argument with regard to cigarettes. Of course, we now know the dangers of cigarettes. This is an unregulated product, and as I said in my remarks, generally in this regard, you err on the side of caution. Certainly, minors should not have access to this kind of product in the first place, and for adults, we want to make sure, since quite frankly we don't know everything that is in this particular product, that people should not be subject in enclosed places, in workplaces similar to cigarettes, that the general public should not be subject to what you want to do on a personal level. Again, much like cigarettes. If you want to do this, it is your personal choice. You can go to places where this is allowed, but our responsibility is to protect the general public, and that's the same thing that we did with the Clean Indoor Air Worker Protection Law, which had, again, many doubters. I find it interesting that even smokers seem to enjoy being able to go into a place and not smell other people's smoke or be subject to the health effects of it. Sure. Councilman Green.
Okay. Thank you. I just wanted to add, and this is something I said in City Council, I think we also have to remember that a lot of the producers of these products are the tobacco companies. They were the companies that first said cigarette smoking was not that hazardous, that secondhand smoke was not hazardous. And now they're saying these products are harmless. Well, I'm sorry, I don't trust them. I don't think a lot of the public trust them. And I think we have to keep that in mind. They were the ones who put a tremendous amount of money into advertising against these bills. So I think that is significant fact that the tobacco companies are some of the main producers of these products.
So I think the last part again, I've not heard that term or that phraseology. This is about public health and public health solely. And one of the main responsibilities of any government is to protect its citizens in a variety of ways. This is one of those ways from the health side. Anything else?
I'd like to ask Dr. Schwartz, there was a concern that this could, as people try to wean themselves off of tobacco, they obviously use this product. There's a concern that if they can't, they may go back on cigarettes.
I hope that you and the public understand that we in Philadelphia have not said you may not use e-cigarettes. We have said that there are limits on use, that young people under the age of 18 should not be using, but that if you want to use as an adult, you may use as an adult, you just can't use in places where it is likely that others will be exposed to the vapor. So we're not banning. And we believe that more research and more time is needed, and in particular, I hope you heard me say, we think this should be a regulated product so that we know what's in them, we know how much content is there, and that they are subject to standards that hopefully will promote both the public's health and the public's safety.
Anything else? Okay, thank you all very much. And again, I think as Dr. Schwartz said, I think it was Dr. Schwartz, those who worked on this, this initiative, this is another proud, proud moment in the history of the city of Philadelphia. You have done so much for so many, and you will also, again, help to save lives and protect the public's health. Thanks a lot. Bye-bye.